A research team at Boise State University says they're a step ahead of the curve. Their computer model can predict spikes in COVID hospitalizations and deaths as well, weeks in advance.
Wow, that's impressive. They're doing this with wastewater data, which has been really key throughout this entire pandemic. Their paper is now officially peer-reviewed and published. They tell our Andrew Bartline, who's been very busy today, that it's a valuable tool for public health.
The work built behind these Boise State brick walls,
this is the paper here.
it's laying the foundation of a fluid finding, fueled in part by following family footsteps.
And it stuck for my entire life, so.
That's Max Mortimer.
It's in the blood, yeah, in the DNA.
Both parents work in science. But he's more focused on what's in the water.
We're able to predict hospitalizations from COVID or COVID-related hospitalizations and deaths using wastewater counts.
It's taken years of data, months of math, and assistance from a computer model.
And thank you everyone for contributing a little wastewater, every day.
Dr. Greg Hampikian's lab spearheaded the project.
And you see sometimes the wastewater COVID's peaking.
This graph shows COVID levels in the wastewater trend roughly 2 weeks ahead of reported hospitalizations. The correlation holds up for deaths too. After interpreting the first set of data, this magenta line accurately predicted the trend in advance.
And that's computer predicted.
Predicting both hospitalizations and deaths, Hampikian says that makes this model unique.
And the value of that was to give hospitals a chance to prepare for what was going to happen with a surge.
Dr. David Pate is on Governor Brad Little's coronavirus work team.
We have come to really appreciate the value of wastewater testing and sampling for infectious diseases.
Pate says this kind of application can be utilized for other diseases too, making predictive wastewater models a valuable tool for public health.
In large, complex data sets,
where other future models can follow the footsteps.
I think anybody could do it if they want to put the effort in.
Back to the original DNA.
I think it's going to change how we deal with public health crises.
Now, this model could be used to predict spikes in other diseases as well.
I didn't realize this was a thing until COVID.
I know, me neither.
The possibilities are, well, not endless, but they're pretty expansive.
Yeah,
and that could be
helpful.
anything from flu to polio that they can predict with this stuff. It was amazing.